China's healthcare system, long glorified by state media as a symbol of national progress, is in fact decaying from within. Behind the gleaming hospital walls and state-of-the-art equipment presented to the world lies a bureaucratic machine riddled with corruption, negligence, and institutional rot. From the chaotic early days of the COVID-19 pandemic to the ongoing stream of silent tragedies unfolding daily in local clinics and emergency rooms, the failures of Chinese hospitals have not only claimed countless lives, but also exposed a deeply entrenched culture of mismanagement and abuse of power. Stories of doctors demanding bribes for surgery, fake ambulance services extorting patients' families, or hospital administrators embezzling public health funds are no longer shocking. They've become disturbingly routine. Throughout the COVID-19 crisis, hospitals across China became infamous not for saving lives, but for abandoning them. In early 2020, whistleblowers like Dr. Li Wenliang tried to raise the alarm about the virus, only to be silenced by authorities and ignored by hospital systems that prioritized pleasing the regime over protecting patients. During the most severe outbreaks, countless patients died not because the virus was too deadly, but because the healthcare system simply could not or would not treat them in time. Social media was flooded with images of patients lying helpless on hospital floors, gasping for air without oxygen tanks, while exhausted medical staff were forced to turn people away at the gates. Instead of transparency and triage, hospitals operated in an atmosphere of fear, secrecy, and performance, where image mattered more than ethics. These institutional failures did not vanish with the end of the pandemic. In recent years, China has witnessed a string of heartbreaking cases that reveal the full extent of the healthcare system's decay. Recently, a 27-year-old woman died in Xi'an after being bitten by a snake. Not because the bite was untreatable, but because 2 hospitals misdiagnosed her, delayed treatment for hours, and failed to provide even the most basic emergency care. In another infuriating case, a dying elderly man in Zhangjiang was charged over $250.00 for a 3-kilometer ride in a so-called ambulance, in reality an unlicensed scam operation allowed to function openly under the indifferent gaze of hospital officials. These stories are not outliers, they are the norm. Worse still, rampant corruption within China's hospital system has turned an already dire situation into an unbearable crisis. Senior doctors often openly demand bribes if patients want to be operated on sooner. Hospital directors accept kickbacks from pharmaceutical companies in exchange for prescribing unnecessary medications. Public funds meant for rural health care are routinely embezzled, leaving millions in remote areas without access to even the most basic medical services. While the Chinese Communist Party continues to boast about universal health care coverage, the reality faced by ordinary people is a dystopian nightmare. Endless waiting lines, apathetic doctors, and life or math decisions dictated not by need, but by money. In this report, we will examine just a few among countless incidents that reveal the true face of China's crumbling healthcare system, a system where human life is valued less than profit, where errors are concealed, and where justice for victims is almost non-existent. A new virus variant is spreading rapidly in China, prompting warnings from local doctors about the risk of long-term health effects. The calm days are over. The United States has tightened its visa policy, sending hundreds of thousands of Chinese students into panic. The visa storm has truly struck. Currently, around 277,000 Chinese students in the U.S. are facing potential deportation or visa revocation as U.S.-China tensions intensify. All developments are being covered in today's edition of China Truths. Back to the epidemic. A new variant called XTV1 is sweeping across multiple provinces in China. A deputy chief physician from the orthopedics department of Wanjing Hospital under the China Academy of Chinese Medical Sciences released a video on the Douyin platform warning of a sharp spike in COVID-19 cases. According to him, this new variant spreads much faster than previous strains and can escalate within just 48 hours after infection. The most alarming symptom is silent hypoxia, a dangerous drop in blood oxygen levels that occurs without noticeable shortness of breath. By the time it's detected, the lungs may already be severely damaged, even life-threatening. The doctor warned that this variant may lead to long-term health complications. In Guangdong province, a pediatrician also tested positive and shared her case in a video, stressing that COVID has never truly gone away. Despite the removal of lockdown measures, the COVID positivity rate in China is steadily rising. While many current cases resemble a common cold, citizens claim the government has deliberately concealed the scale of the outbreak. Instead of diagnosing COVID-19, many doctors label cases as influenza A or mycoplasma pneumonia to downplay the severity. Even renowned virologist Zhang Nanshan recently admitted that the outbreak has peaked in China. On social media, people are reporting that schools in Guangdong, Shanxi, Jiangsu, and other regions have been forced to close or shift students to home quarantine. However, due to censorship and deleted posts, the public is only seeing the tip of the iceberg. Many families and communities have experienced widespread infection. One user posted, "All 12 members of my family caught it. The spread is insane." Another wrote, "3 of 5 in my household were infected. My youngest brought it home from kindergarten." Someone else commented, "All 3 of us have pneumonia. My monthly salary isn't even enough to cover the hospital bills." Since May, young adults have been frequently reporting infections, some for the 3rd or 4th time, suggesting possible cumulative health effects. Another post mentioned that deaths in Qingdao have been increasing since early 2025. According to China's CDC, April saw 168,570 new COVID cases, with 340 severe cases and 9 deaths. In week 18 of 2025, late April to early May, the National Influenza Surveillance System recorded a COVID positivity rate of 16.2%, more than double the 7.5% from early April. COVID has ranked as the top respiratory illness in outpatient cases for 3 consecutive weeks. Vida Lin Xiao, a virologist and former lab director at the U.S. Army Research Institute, said during the Elite Forum program that China's CDC data is highly misleading. They only release positivity rates without revealing the actual number of infections, he stated. "That's why I consider it deceptive." Independent journalist Lai Jun, who also appeared on the program, said that COVID never truly left China. Instead, the CCP has swung between 2 extremes, either imposing draconian lockdowns with no scientific basis, or pretending the virus no longer exists, ignoring rising death tolls. For the Chinese people, he said, this is an unprecedented catastrophe, a disaster caused by both nature and human mismanagement. In a shocking display of exploitation within China's healthcare system, an elderly man in Zhanjiang, Guangdong province, was charged over $250 for a mere 3-kilometer ambulance ride that lasted less than 15 minutes. As the man lay dying from heart failure, cancer, and multi-organ collapse after 2 months in the hospital, his family was told by doctors that further treatment was pointless. Left with no choice, they decided to bring him home for palliative care. However, the hospital refused to provide an official ambulance, forcing the family to rely on a so-called private ambulance introduced by a doctor. The vehicle looked official from the outside, with flashing lights and staff dressed to imitate medical personnel. But inside, it contained nothing more than a stretcher and a portable oxygen bag, no medication, no monitoring equipment, and no real medical support. The family, desperate and grieving, was presented with a bill of over $250 for the short ride, a blatant act of price gouging in a moment of vulnerability. Unfortunately, this kind of predatory behavior is not unique. In another case earlier this year, a woman in Shanxi province paid more than $1,170 to transport her terminally ill father 800 kilometers from Beijing, after agreeing to what she believed was a fair price of around $1.00 per kilometer. Once the journey began, hidden charges piled up. A filthy blanket cost $42.00. 6 ice packs for her father's fever totaled another $42.00. Suction procedures were billed at $8.00 each. Breakfast was $14.00. And additional fees for oxygen and monitoring were added without notice. By the time she realized the full cost, it was too late. These are not isolated incidents. They are symptoms of a system that allows unregulated, unauthorized ambulance services to thrive, preying on families in distress. Hospitals deny responsibility, local governments fail to regulate, and grieving relatives are left defenseless against a network of opportunists who see human suffering as a lucrative business. What's happening in China is not just negligence, it's institutionalized exploitation, carried out in plain sight and protected by silence. As long as authorities turn a blind eye, countless families will continue to be deceived, extorted, and abandoned, even as their loved ones take their final breath. 27-year-old woman dies after snakebite. In Sanya's family blames hospitals for misdiagnosis and delayed treatment. A 27-year-old woman from mainland China tragically died after being bitten by a snake while traveling in Sanya Hainan province. Her family alleges that a series of medical errors and delays by 2 local hospitals directly led to her death. The case has sparked widespread anger online and quickly climbed to the top of China's trending news lists. According to a post published on June 3 by the victim's younger sister, known online as Xiao Li, her sister, referred to by the pseudonym Tian, was bitten by a snake on the night of June 1 while vacationing in Sanya. She was taken to 2 different hospitals for treatment, but ultimately passed away early the next morning on June 2. According to reports from Red Star News, the family believes that the first hospital, Sanya Central Hospital, misdiagnosed the case and delayed treatment, while the second facility, Sanya 425 Hospital, provided inadequate emergency care. They say the hospital's negligence was the decisive factor in her death. The tragedy reportedly began around 11 p.m. on June 1, when Tian was bitten by a snake. Her family rushed her to Sanya Central Hospital, where she arrived at approximately 1 a.m. on June 2. Blood tests showed elevated white blood cell counts and low platelets, but doctors dismissed the possibility of a snake bite, instead diagnosing it as a bug bite or an unknown bite. Based on that diagnosis, they administered only basic saline fluid. When she vomited, they gave her anti-nausea medication. It was not until she began convulsing and experienced numbness in her tongue that doctors finally agreed to transfer her to another facility. However, the transfer only led to more confusion. At Sanya 425 Hospital, instead of taking the patient directly to the emergency room, staff inexplicably sent her to a general ward on the 5th floor. A room with no life-saving equipment whatsoever. According to Xiao Li, by the time her sister arrived, she was already unconscious and the critical window for proper intervention had passed. The family claims the first hospital delayed proper treatment by over 4 hours, which proved fatal. The incident has drawn widespread criticism from netizens across China. One user wrote, "The first hospital must be held accountable, regardless of whether it was a confirmed snakebite. Basic emergency protocols should have been followed." Another commented, "Sanya is full of snakes. After 7 p.m., don't go near the beach, forest, or anywhere remote." Others emphasized the importance of documenting the snake for proper antivenom treatment, while many condemned the hospital's apparent lack of preparedness and training. In response to the growing public outrage, Sanya's Health Commission confirmed on June 3 that they had launched an official investigation, held emergency meetings, and begun reviewing medical records from both hospitals. This case has become yet another example of China's deteriorating medical accountability, where patients in critical condition fall victim to misjudgment, negligence, and a bureaucratic healthcare system unable to respond swiftly when every second counts. As the family mourns their loss, the public is once again left asking, how many more lives must be lost before hospital negligence is truly addressed? Impending catastrophe, the final agony of the Chinese Communist Party. Since the beginning of 2025, a series of harsh and unprecedented events has swept across China, almost as if heaven and earth themselves are signaling the collapse of a regime that has ruled with an iron fist for nearly a century. From extreme natural disasters and medical crises to brutal political infighting and the most intense confrontation with the United States in decades, the Chinese Communist Party, CCP, finds itself besieged on all fronts, and the harder it fights, the deeper it sinks into a swamp of self-destruction. On April 11, a massive sandstorm originating from Xinjiang, Gansu, and Inner Mongolia swept across 18 provinces and cities, ravaging everything in its path from north to south, even reaching as far as Hainan Island. In Beijing, wind speeds reached force 14 on the Beaufort scale, toppling more than 1,200 trees. Even state media were forced to admit this was the most severe climate event in recent years. In traditional Chinese culture, such phenomena are seen as heavenly omens, warnings from above of impending disaster. And when one looks at the current state of Chinese society, it's difficult to believe this is merely coincidence. Inside the regime, the battle for power has escalated to a level of merciless purges. Since the 20th Party Congress, numerous high-ranking officials, many of them personally appointed by Xi Jinping, have been purged, including ministers of defense, members of the Central Military Commission, and commanders of the Air Force and Navy. The mysterious death of former Premier Li Keqiang just 7 months after retirement, and the imprisonment of a former journalist who called for an investigation, have sparked international outrage. When even the ruling elite cannot coexist, how can stability be expected for the general population? On the international stage, the CCP is locked in its most intense tariff war ever with the United States. Ever since President Donald Trump announced his comprehensive reciprocal tariff plan, China has been the primary target. Both sides have escalated retaliatory tariffs, reaching 125%, then 145%, with no signs of de-escalation. While over 75 countries have chosen to negotiate with the U.S., the CCP alone has reacted aggressively, launching countermeasures that many analysts describe as self-sabotaging, especially amid a domestic economy spiraling into crisis, mounting local government debt, a frozen real estate sector, surging unemployment, and collapsing consumer confidence. Yet the most devastating threat may be coming from the healthcare front. In April, WHO Director General Tedros Adhanom warned that the next global pandemic could erupt at any time. According to WHO data, just in the first quarter of 2025, outbreaks of Ebola, Marburg virus, and avian flu have emerged globally, with avian flu already spreading to cattle and humans. In China, a new variant of the coronavirus has been detected, once again pushing hospitals into a state of collapse. COVID positivity rates are surging, particularly in northern provinces. Citizens report a spike in sudden deaths across all age groups. Hospitals and crematoriums are overwhelmed. In many rural areas, the dead are now being buried instead of cremated due to capacity shortages. If another major outbreak occurs, it could be the final blow that Beijing cannot recover from. None of this is accidental. A regime that has brutally persecuted religious faith for over 26 years, especially its barbaric crackdown on Falun Gong, including atrocities like live organ harvesting, has amassed a karmic debt too great to ignore. Over 440 million Chinese citizens have openly withdrawn from the party, Youth League and Young Pioneers, a spiritual awakening of unprecedented scale in modern history. While the CCP continues to lie, suppress, and violate human rights, a movement for justice and truth has begun to rise from within the Chinese people themselves. If heaven truly sees all, then what we are witnessing now is merely the beginning of the inevitable collapse of a regime whose crimes against its own people and against humanity can no longer be forgiven. The catastrophe is no longer far away. Indeed, it may be the final, fatal blow that brings an end to the Chinese Communist Party.